Hello, in this video I'm going to be talking about sleep disturbances in people undergoing treatment for breast cancer, or perhaps even before treatment has started. Before I go on, I'd love to invite you to subscribe to our channel. We put out content about 3 times a week, and so there's always something new for you to watch. So sleep disturbances are so common during breast cancer and its treatment. From the minute you're told that your mammogram shows an abnormality or you feel something abnormal in your breast, your sleep is already set up to be disturbed. And then when we add treatment in, there are multiple other things that can contribute to sleep problems. So I'll go through each of the things that can cause sleep problems, and then I'll give you some tips that can help with your sleep. I'll also talk about why sleep is so important. So let's start with surgery. So surgery often happens first. Surgery, of course, can lead to pain, and that can make it difficult for you to get comfortable when you're when you're trying to get through breast cancer and its treatment. You're told that you have to limit your mobility when you first have your surgery. If the lymph nodes are operated on, the breast itself may be tender. If you have a mastectomy, if you have reconstruction, of course, it can be really uncomfortable in the first few days, especially, and even up to 6 or longer weeks, depending on how your healing is going. You're not doing anything wrong if it's still hurting, but just know that sleep disturbances are very common after really any surgery, because you've been under anesthesia and you are on pain medicine, which we know can alter sleep as well. So this should get better over the ensuing weeks after your procedure. If it doesn't, if you're still having discomfort, reach out to your medical team. They may have some tips for you. Things you can do to help with discomfort or pain are to put some ice on the surgical incisions. We recommend not putting it exactly on the incisions, but through a towel so that you don't damage the skin, because the sensation will be a little different. We don't recommend heat at early on, though later on heat might be helpful. But let's talk really right after surgery. So talk with your medical team and find out if that's an option for you to use ice on your surgical incisions. Next, I'm going to talk about chemotherapy, because that tends to happen following surgery, and it may even come before surgery, of course. So chemotherapy can alter sleep patterns, and the main culprit is actually the steroids we give you to help prevent nausea and other side effects, like having an allergic reaction to some of our medications. So corticosteroids like prednisone or dexamethasone are highly effective in preventing nausea and other side effects of chemotherapy, but they have their own side effects themselves, and the biggest one is sleep disturbance. You might find that you are just really activated and really active at night when you should be winding down. That's really quite common. Now, some of the meds that we use to help prevent nausea can help with sleep. So ask your medical team about the timing of your anti-nausea meds and see if you can take them at bedtime, and if that might help you get a better night's rest and counteract the corticosteroids. It's also possible that experts can decrease the doses of corticosteroids with each cycle if you're having more side effects and you're not struggling with nausea or vomiting. So that's something you can bring up with your medical team. Is that an option for you? That's something that may be offered to you. So targeted therapy, similarly, especially at the beginning, we will often give corticosteroids to prevent a reaction, and the same corticosteroids can cause problems with difficulty sleeping. Endocrine therapy or hormonal therapy, which is used to treat people who have hormone receptor positive breast cancer, can cause sleep disturbances because it alters the way estrogen interacts not just with the cancer cells, but with the other estrogen receptors in your body. So we know that endocrine therapy can lead to sleep problems. There are all kinds of things that might be offered to you, like even taking a tamoxifen tablet and taking half the dose twice a day has helped some people. It's not really clear why that would, even if it's just feeling like you're doing something different. If that helps, that might be something you can talk about with your team as well. We also can help with sleep problems with other medications, but of course we like to avoid giving one medication to offset the side effect of another. So I'll talk about in a moment other things that you can do. Then I mentioned pain medication can actually interfere with sleep as well. If it makes us drowsy throughout the day, it can make it hard for us to get really valuable sleep at night. Radiation therapy can also cause discomfort and pain, and that can make it hard for you to get comfortable at night. Talk with your team about different ointments or creams that can be useful to help with the pain that you're having. Ask them if putting something cool on the area that's getting radiated is an option for you. As before, you wouldn't want to put ice directly on the skin, but perhaps through a towel. Again, talk this over with your team to make sure it's okay in your particular case. And finally, breast cancer is so disruptive. Breast cancer leads to anxiety and stress and cognitive overload. You're going through a lot of things in your life, and I don't know about you, but almost anything can make it difficult to fall asleep or stay asleep. So just having, even let's say you're not yet having surgery, you're not having chemotherapy or endocrine therapy yet, just a new diagnosis of anything serious can cause problems with sleep mediated through stress and anxiety and rumination. So next I'm going to talk about why is sleep so important, as if you need me to tell you. But I do want to tell you that your physical health really depends on the quality of sleep that you get. We're learning more and more about the importance of sleep to overall physical health. Then of course there's mental health, how you feel the next day, how you can tolerate the slings and arrows that life throws at us is also going to depend on how well you sleep. Your mood can depend on how well you sleep. So there are sort of physical, and then the rest, mental and psychological health to me are equally important to physical health. In terms of managing pain, sleep is really important. In terms of your social interactions, as you know, if you've had a bad night's sleep, you're just less able to put up with all the other stuff that goes on in the world or the things that people ask of you. In terms of your functioning at work and in your family, sleep is mission critical. Cognitive function, how well you can concentrate, can depend on your sleep. It may even be that healing after wounds and healing after chemotherapy and restoring the immune system happens when we sleep. We know that a lot of learning happens when we sleep, especially in school-age children, that they actually learn more while they're sleeping. We know a whole host of recovery of the body and mind happens when we're sleeping. So this is a time to prioritize your sleep for all the reasons that I mentioned. So what are some strategies you can take to improve your sleep? Well, I'm going to start with some pretty obvious ones, and you'll add in the comments below your own tips. But I'm just going to tell you some things to avoid, some things you can do, and then some other considerations. So things to avoid, it might seem obvious, but avoiding caffeine, caffeinated drinks, green tea has caffeine, sodas, coffee, chocolate has caffeine. Avoiding caffeine, believe it or not, after noon makes a difference in your sleep. So even while the alerting effects of, that awakeness that you feel after having a cup of coffee might be gone after noon, the effects it has on sleep, if you drink caffeine or have caffeine in your diet after noon, can impact your sleep. So experiment and maybe decrease the caffeine you have after the lunch hour. If you work at night, adjust this for your own schedule. Other things to avoid are alcohol and other drugs. So alcohol can help us fall asleep, but it interferes with what's called the sleep architecture and can actually lead to less deep sleep. So you may wake up less rested after a night of sleep if you had alcohol at bedtime. So this is something to think about cutting out. Smoking cigarettes can be alerting. Nicotine and other things in cigarettes can be alerting and make it hard for you to sleep. So we recommend that if you can't yet quit smoking, and we do have a video on the importance of and ways to get help to quit smoking, at least try to cut back on your cigarettes at night. Other things to avoid are screens like television and your phone for at least an hour before bed. It's hard. You know, a lot of us read the newspaper on our phones at night or go on social media at night. If you can somehow set your phone, maybe to encourage you to not use your phone about an hour or even 2 before you go to bed, that can be really helpful. Strenuous exercise at night can also be really alerting and make it hard for you to sleep. So those are some things to avoid. Some things you can do are exercise, just not at bedtime. So getting movement every day can help you fall asleep and have more restorative sleep. This might just be a walk, or if you've been exercising regularly and more strenuously before your diagnosis, keep up to the extent that you are able. You don't have to maintain that level, though certainly nobody should tell you that you can't. Other things that can help are having a soothing bedtime routine. Turn the lights down low. Develop a ritual at bedtime that tells your body and mind it's time to get ready for bed, whether it's reading or meditating or writing in your journal. Those sorts of things can help. Setting the routine so that it's the same every day can sort of program your body and mind to say, oh, we're getting ready for bed. Use your bedroom only for sleep and for sex. Don't use your bed for doing other things. If you find that you're really having trouble sleeping, watch television and read in another room. Again, what you're trying to do is tell your body, this is bedtime, this is time to sleep. This can be a lot of changes for you. You might want to experiment with 1 or 2 of these suggestions rather than do them all wholesale. Some people also find that doing everything all at once is a big help. Get your partner or other family members to help you out. So if you have kids, tell them you're not going to be texting them late at night. It makes it hard for you to sleep. Tell your partner, I need your help supporting me in this new bedtime routine. There are 2 other things that can be really helpful. One is to limit your napping. So if you need to take a rest, try to limit that to 20 to 40 minutes. If you sleep more than that, it's going to tell your body, I don't need to sleep as well tonight or as much tonight. It's not that sleep and naps talk to our body, but you get what I'm saying. So try to limit your naps and don't nap within sort of around the dinner hour. It's so tempting and so lovely to take a nap in the late afternoon, you know, before everybody comes home. But if you're finding you have sleep problems, you may want to limit that or scoot your naps to earlier in the day if you're able to take a nap. Other things are to make sure your bedroom is cool. And some of the things that have been shown to help are to be in warm and then cool. So a warm shower or a warm bath and then into a cool bed and bedroom. So these are the things that can help us get more restorative sleep and help us fall asleep. I hope this has been helpful. Drop your tips below or ask questions. We try to get back to you within a week or at the latest 2. Share your tips with the Yerbba community. We're all in this together, helping each other. We try to provide a supportive space as well as information. Don't forget to subscribe. You can follow us on Instagram, and as always, go to yerbba.com to get your personalized report. Thank you for watching.